Hello, everyone. Welcome. Thank you for joining us tonight on Latino Surgical Society's fifth installment of Pass the Baton. This webinar is a resident-to-resident advice on excelling during your intern year. So it's an LSS event geared towards surgical trainees. And hopefully tonight we're going to hear from current Latinx surgical residents who are either finishing their first year of training, as well as more senior residents at various programs across the nation. We'll be focusing on their internship experiences and what knowledge they've gained to excel during their first year, and any tips and tricks they can share with us as we'll be entering our first year of general surgery training. So we hope that the current and prospective surgical interns who are in attendance tonight and will be reviewing the recording later on YouTube will benefit from the wisdom and the pearls that will be shared by today's outstanding speakers.
Thank you, Haldo. And my name is Denise. I'm an incoming intern. And on this panel, we're honored to have a variety of speakers. Today, we have Dr. Azalia Avila. I would love to say that she's a PGY5 at Memorial Health, but she just graduated 2 days ago. She's at Pembroke Pines, Florida. Originally, she's from a small town in Cuba. She immigrated to the US at age 11, and she did this to escape political persecution. So we commend her for that. Eventually, she settled in Hialeah, Florida. Prior to medical school, she worked as a pharmacy technician at a local pharmacy, and she was serving her community there. She completed her MD degree at Georgetown University and decided to return to Florida to pursue a career in general surgery. And she will now be going on to the University in Kentucky, where she will be completing her training in pediatric surgery. So thank you so much, Dr. Avila, for being here today.
Thank you. Thank you so much for having me. It's a pleasure to be here.
And we also have Dr. Sandra Loza-Avalos, who is a PGY1 at OHSU. And Sandra is a first generation Mexican American, and she's now a soon to be PGY2 in general surgery, and she's in Portland, Oregon. She grew up in San Antonio, Texas, which has been my hometown for the last 4 years. She obtained her undergraduate degree and MPH degrees and worked as a research coordinator at the University of Pennsylvania. And she moved to Dallas, Texas, for medical school at UT Southwestern, which is Haldo's alma mater. Is that correct? And before starting her residency journey. So thank you so much, Sandra, for being here, Dr. Loza. We appreciate you so much.
Thank you all for having me. It's an honor.
And we are still waiting on Dr. Andres Abreu. He's also PGY1. He's at UT Southwestern. He's going to be joining us later. He's a general surgery intern at UT Southwestern at Parkland Memorial Hospital. And of course, we have Dr. Alex Valenzuela, PGY1. He's a general surgery intern at New York Presbyterian Weill Cornell Medical Center. He was born and raised in California, Central Valley, by a single migrant farm worker mother. He's proud for generation college graduate from UC San Diego, and he earned his MD through UCLA Charles R. Drew Medical Education Program, and he's very passionate about pursuing a career as a physician scientist. Outside of the hospital, Alex really enjoys playing basketball, and he goes for runs and relaxing a game of League of the Legends. So he's the whole package. We are so happy to have Dr. Valenzuela with us. Thank you so much for being here, Doctor.
Yeah, happy to be here.
So now that we have everyone introduced, we're going to get started with our panel, and we have a couple of questions for all the panelists. Feel free to answer at your leisure. The first question is geared towards everyone. So now that you've successfully completed y'all's first year of residency, and I know we have different levels of residents in the panel, what were your expectations? And I know that Dr. Avila has basically completed her residency, but when you were starting, what were your expectations coming into your first year of residency? And what were the steepest parts of your learning curve as an intern?
Sure, it definitely feels like a lifetime ago, but not really, because I still remember, that terrifying feeling of starting my first year. I think I honestly expected to be very busy, and that proved to be right. I expected long hours and, probably poor sleep, but I also expected to learn a ton. And that's exactly what happened. I think the steepest part of the learning curve coming in was to manage the list. When when
Yeah.
you're a sub I and you see your intern as a student managing however long the census is, and keeping tabs and following up on all the labs imaging and everything else. It gets easier as time goes by, but definitely the first few months of residency were really difficult to kind of manage all of that all at once.
Yeah. Was there any way that you were able to overcome that?
I think the only true way is to practice, is to just continue to come in with, every day is a brand new day, is a new page, and you just kind of like in sports, you have to forget what happened in the game yesterday and come in with a fresh mind and just try again. And little by little, without you noticing it, it starts to get easier and easier until you can kind of remember the list off the top of your head without having to write every single detail down.
Thank you so much. I would love to hear from Dr. Loza-Avalos. What do you think was your steepest part of the learning curve? What were your expectations coming in?
Yeah, I think the organization piece, I think, is really key. I knew that you'd have to, like an intern, you have to be organized going into it. And so I think whatever way that works for you, do that.
Mhm.
Um, for me, and I think for a lot of people, it's check boxes. So check boxes, like, fold your paper into thirds, make the check boxes. Like, is the note done? Are the electrolytes repleted? Did I check these labs? What tasks do I have to follow up on? And it does get easier over time. And I think that steepest learning curve is um, you'll find that you adapt very quickly, because I think we're all in medicine because we're very adaptable and um, resilient, and we're here, because we want to be here. So I think that will come pretty easily as long as you manage to stay organized and not get too in your head about it. And I think this other steep learning curve is being okay with like needing to learn things. I think it's like I came into intern year and I remember being like, I don't know anything, and I'm gonna like hurt someone. Like, I can't believe they let me be a doctor. Can't believe they let me be a surgeon. But I think learning that you have a long ways to go and that's okay is also really important and can take time. And it's something like you'll probably work on your entire intern year and the rest of residency.
Yeah. Thank you for sharing that. That's so vulnerable, but like so real. Dr. Valenzuela, do you have anything to add to that?
Yeah, I mean, I agree with everything that's already been said, but I think for me, like the first 6, 7 months were like really like intimidating and scary, and there was always something new that would come up. And I think once you get into that rhythm, like I remember the first 7, 8 months, I would come home and just fall asleep because I didn't have the mental capacity to do anything else. But after a while, like you start to see routines, and you kind of get in the groove of what you start to become comfortable with what was uncomfortable at first. Like your first rapid or your first code that you're called to as an intern can be pretty scary, but then you learn how to deal with them, as you guys have all said, just by doing. Um, so yeah, I think the first few months are really hard. It gets better because you just learn and get comfortable. And you like develop your own systems, like as you guys already said, and just kind of continue with them. Um, yeah, that's kind of been the big thing of intern year. Is like the first few months were definitely really hard. It's just a big transition from med school.
Thank you all for that insight. I think it's really inspiring to hear about how you all kind of overcame some of the challenges with organization, running the list. In that same vein, becoming a doctor at this point from medical school, as you mentioned, Dr. Valenzuela, can be a really challenging transition. And you hear a lot about the emotional toll that it can also take, besides you mentioned the mental taxation from having these long days. Can you all tell us about some of your highest and lowest moments and how you celebrated these high moments that you overcame obstacles during your intern year? And for this question, we can just go in the reverse order. Just skip the silence.
No worries. Some of the highest moments have come kind of towards the end of intern year. In general surgery, sometimes we like forget about some more of the medicine knowledge or stuff that we don't see as much. And I just remember recently I was on a vascular service where like a patient of ours was like persistently hypertensive and hyperkalemic, and we didn't really have a good reason. I was like, I don't know, this sounds suspicious. I was like, this could be something like AdSense, and just like working that up. And then my senior being like, no, you're like, it's not worth working up. And then like the next day, I'm like, I don't know, it's not getting better. So then them finally listening to me, and then it's like the medicine team is like, oh, good job, I'm working this up. And like the patient ended up having AdSense. We fixed her problem. So things like that are definitely like when you go home and you're like, oh, I learned something in medicine and medical school, and I'm applying it now. Or even just like on a busy trauma service and you're like able to take care of a 40 list and be on top of everything, and your senior's like asking you, have you done this? Have you done this? And you're like, yes, like stop asking me. I'm at the point where you don't have to ask me anymore. Like those are just like great feelings as an intern. Some of the lowest, I think, were probably toward the beginning where getting called to my first rap and you just don't really know what to do, and you might like not know what orders need to be done. But luckily you have seniors to fall back on. So don't forget about asking your seniors for help. I think those are kind of the things. Then you go home and you're just like dreading the mistakes that you might have made. It might like be difficult to sleep that night, but then you come in the next day and you have to start all over. So those are kind of the lowest points, and some of the highest for me.
Yeah, I think um that's like awesome to hear about you working up the like AdSense disease. That's I have like a similar story. I think I have like two pretty good highs that are very similar to that. One being I think this was like my first big like win of intern year, and I was like, oh yeah, that's I want to be a general surgeon because I think for me, general surgery is, we are like the doctor's doctors. Like I think we have to know a little bit of everything. Um, and I got called to the ED when I was on nights covering like a bunch of different services, and they wanted me to drain this abscess on a kid, and I was like, I don't think that's an abscess. That's not something I want to stab with a knife. Like I think it's like a malignancy. I think they need to like we need hemonc involved. I called my attending and staffed with him, and he agreed with me. And so I was like, okay, I'm gonna, I told the ED I recommend that like you call hemonc and have them evaluate the kid. And hemonc drops a note and is like, this is an abscess. General surgery is like crazy. And then a week later, the kid was admitted to the hemonc service with cancer. And I caught that because this kid had been going to like doctors this whole time, and I just did my like review of systems that I do when I like talk to like any patient that I'm meeting. And so that reminded me like one, oh, I do have like some brain cells, and two, I think when things get really stressful and there's a lot going on and you enter a situation where you have zero idea what's going on, just go back to your basics, like the things that you've relied on like all through medical school, like just okay, let me just, ABCs, like is my review, let me do my review of systems and start thinking about this like in a methodical way. And I think that has helped kind of like just in the future, I was like, oh, I actually can do this. I can face these hard clinical problems and come up with a differential, figure them out. And the other one was a kid was having stomach pain. And I was like, kids are weird. Let's just test their poop, and got a stool panel, and they had giardia. And everyone was like, how did you know that? And I was like, they were doing weird things, and that happens. Like you just have to look at the poop. So always like go back to your basics. And I think that helps you, during those like lows. I feel some of my lows, I guess. I feel like in the hospital, there are a lot of like interpersonal things, and you're always like, oh, like, am I interacting well with this group of people, with this group of people? And there's a lot of personalities and things to manage. I think that's probably true no matter where you go for residency. And sometimes that can take a toll in addition to kind of managing like the patients and the families and the emotional side of that. So for me, I think there have been days where that can be draining, but then reminding myself, like this is how this person is probably approaching it, like putting myself in those shoes and venting to, my colleagues or my friends, my co-interns. And then just like Dr. Valenzuela said, like, and Dr. Avila said, like, just, every day is a new day, just reset. I think that helps a lot.
Thank you guys for sharing. Those are some really cool stories. And it sounds like you want to be a pediatric surgeon too. You had two high kid stories, just sensing a
Trauma.
I'll start with the lows, because I think my intern year, my program, we had to do Q3 24-hour in-house call for a trauma. And I remember those days were like really, really tough because of course they tell you it's a 24-hour workday, but it's really a 28-hour workday. And you're really, really tired all the time, and you don't have time to sit down and think about what you're doing. You're just kind of going in autopilot or some sort of pilot, you're hoping. Um, and so I remember thinking to myself, I'm really not learning anything. I don't know, what am I doing here? You know, those days were really, really tough. I think the way that I overcame those moments was to just rely on my support system, which at the time was my parents. I was lucky enough that they lived close by. And, you know, I would talk to them and I would say, right now, I need to be selfish. And right now, you know, I don't have really a lot of time to like spend time and be very happy, to be honest. Like, I'm just going through this and it's temporary and I need you guys. Um, and then some of the highest, I think my highest moment of intern year was the very end of it after, or not the very end of it, I guess mid of it after ABSITE, where, you know, when the test results did come back, I miraculously got a pretty decent score in it. And I was like, okay, well, like, even though like I felt like I wasn't learning anything and I felt like I didn't have enough time to study, something did happen. Like, you do learn on the job, you do learn by other people questioning you and asking you, and you do learn by seeing as many patients as you can during your time. So if you can't utilize your time to kind of, you know, study or dedicate your time to study, you are learning even though you think you're not. So that's pretty good.
Thank you so much for sharing. And I think like that was so, everyone's experience is so vulnerable, but also like so valuable to everyone that's coming into residency. You did such a perfect segue into like the studying piece because I think we've been hearing left and right as incoming interns, like you have to find time to study. You have to find time to study. And we understand that you're like kind of learning on the job, but also that you have to like um find these times to really kind of hone in. And time is really like a limiting factor during residency. And so we kind of like wanted to get some tidbits for incoming interns on, is there anything you did that really helped you on your first year for like outside or for cases or for anything else that you were like, you know, I really, one, this really helped me, or two, I really wish I would have done this. Um, we would love to hear that from you guys.
Sure. So my I was lucky enough, I don't know that every single program in the country has this, but my specific program has a dedicated like conference day. Ours is like on Thursdays. We're from like 7 in the morning to noon. We don't round, we don't do anything. We just go and we kind of learn. So that was really awesome because we had M&M every week and we had score and we did, you know, questions. So that was already there, but that isn't enough. I think the main thing that I realized later on in intern year that I wish I would have done earlier, is to treat every single case that I was being involved in as a learning experience for the app site. Meaning, if we were doing an appendix, I was going to try and go read that score section or do some True Learn questions on appendix, and making that connection with the patient, so that the learning becomes more relatable and more memorable. I think other things that are an absolute must, at least they were for me. I know that everyone's different when they study, but the True Learn question bank, if you're kind of waiting for one case to roll and you're like just kind of sitting there, you can just pull up your phone and do 2 questions. That's 2 less questions that you have to complete before the app set rolls around. And behind the knife, if you're a person that learns by listening, those app site specific reviews that they have on the podcast were really, really, really helpful. And I would just play them on repeat on the way to work, on the way back, going to the gym, in the shower, whatever, just playing it in the background, even if you're not like actively listening to them.
Yeah, I think one thing for me, it's tough because we are very limited, like as interns, but also everyone in residency. But one thing that I really value is the teaching I've gotten from my seniors. So I will, if we have like time on a service, or I'll just say like, hey, like, can you like teach me about, you know, insert topic, and just do like a 5 minute like little like chalk talk. And will do that. And I find that that's super helpful because then they're talking and it's kind of like ad lib, but they're like, oh yeah, on app side, I've seen questions about this. I've seen questions about that. And I'm a visual learner, so I like Behind the Knife a lot too. And I think they have like on YouTube, like a video series to go with their podcast. Um, but also I like just like I'll just look up the anatomy of like whatever surgery I'm about to do or something, because then I can say, okay, this is where the like HJ is the HJ part, or this is like the roulim, or I'm on Forga right now, so that's what I'm like Googling. But the questions are valuable, and then as I do questions, if whenever I remember to, I'll like make sure I'm looking up like what that anatomy and like what it looks like to get a visual idea, just because that works for me. But yeah, I think definitely utilize your junior and senior and chief residents like on the service, like ask them to teach you, because I promise you they probably do want to teach you. It's just find the right time to.
Yeah, I think a lot of things that I was going to say have already been said, but the big ones for me have been just like learning as you go, and a lot from my juniors and senior residents, just like questioning them on things, as well as like soon a lot of you are going to be the teachers for the med students. So teaching the med students also helps, because like if you prepare them for cases, then you're also kind of preparing for the case as well. And it's like good to have them shine, because then you feel good about yourself. And then other things is we also have a dedicated education day, so that helped me as well. And then the whole thing with like doing questions when you have free time. I did a lot of questions with my like co-interns when we were just sitting around not doing much, and just like testing each other. So a lot of things that I think others have already said.
Thank you all. And so this question that we have is specific for our just finishing, no longer interns, future PGY2s. But what to you two, what is the most important lesson that you've learned from this past year that you have gone through? And is there anything that you would have done differently?
I think in terms of lessons, again, just like being comfortable with being uncomfortable. Like I think that was a hard thing at first when you're coming from like med school to transitioning to being a resident. There's gonna be a lot of situations where you're not really sure what to do or how to handle, but like getting into those situations more will actually make you, I think a better doctor, because you're gonna learn how to handle more like emergent situations. Especially when you're like covering nights, and you have like 50 patients on your list that you have to cover, or trauma, like there's going to be a lot of stuff that it's just going to kind of come out of nowhere. And it's not going to be the usual thing that you see every day. I think in terms of just like tips, I'm sure anyone here could say like just the things that like make a good intern are always like, being reliable, getting things done, being honest, and then just being a hard worker. A lot of times the seniors don't care how much you actually know, but if you're able to get tasks done, a lot of seniors will will be happy with you. But those are like kind of the big things. And then a lot of stuff that's like more medicine, algorithmic, you're gonna learn with time, and it just comes, again, like 7, 8 months in, I was like, all right, this makes sense, because you already know the protocols of like how to like manage patients. But it just comes with time.
Yeah, I think um yeah, I agree with everything like Dr. Valenzuela said. And I think if there was, I don't know if I would change anything, because I feel like um, I really appreciate how much I've learned this year. And so I think just make sure to be really kind with yourself and be like, it's okay that you know nothing, because guess like come July, I'm suddenly going to be in R2 and I'm going to be like, I still don't know more. Like I didn't wake up knowing it exponentially more than I did yesterday when I was still an intern. And I'm going to expect like, for anyone who's like on a service with me, I'm going to be like, yeah, I know I didn't know anything. If you know more than I did, that's awesome. So just be really honest with yourself. And I feel like I don't know, I wish like my co-interns and I got to hang out more, build those like relationships. Like we all hang out, we have a great group chat, but definitely like build those relationships with your co-interns, because these are the people that are going to be with you for like 95% of your life for the next 5+ years. And just enjoy the ride. It's going to be like tough, but I feel like it's really important to enjoy what you can of it, because otherwise you become like the person that no one wants to be on an overnight with, and you don't want to be that person.
Some sage advice there. No, thank you both. I think that's something that's definitely tough to kind of accept, being comfortable, being uncomfortable, or thinking about how much I need to know going soon, as it's coming up, approaching fast. But then transition to Dr. Avila, from a senior point of view, what would be the most valuable advice you could give to the incoming interns after that you've just graduated a couple days ago?
I mean, I think honestly is just to remember that intern year is not forever and that every year will have its own particular challenges. I think that people in general, attendings, nurses, everyone in healthcare kind of hyperfixates on like the interns are coming, and like on July 1st, and everyone's like freaking out. But at the end of the day, the PGY2s are coming and the PGY3s are coming, and everyone is at their own, kind of beginning of a new chapter or a new leaf. So don't be intimidated by what others' perceptions of you are. You have been through medical school. You know what it's like to work hard already because you've made it this far. You know what you're passionate about. You want to be a surgeon. So just embrace it. Learn as much from it as you can, and keep things into perspective. And over the first kind of like 3 months, everyone will forget that July 1st was 3 months ago, and everyone will go back to normal. And the hospital will continue to run in the way that it's always run and the way that it always will run. And, our healthcare system is the way that it is. And we're just kind of little pins in the wheel, or however the expression is. So just take a deep breath and chill, and everything will be okay. There's light somewhere.
I love that. Thank you so much. That's like such good advice. And we're so grateful that we have like people from throughout the continuum of residency that can give us this kind of advice because you said, intern year is not forever and every single year has its own unique challenges. And I think we all need to hear that and understand and give ourselves grace. Unless we hear it from someone else, it doesn't really hold that much value. But when we hear it from someone that's gone through it, it's so valuable. So thank you so much. So my question now is as a person that's Latinx in surgery, can you guys tell us how you think your identity shapes your experience with your patients and your co-interns? You guys are all over the place, so everyone's like in very different parts of the country. We are too, so we kind of want to hear about your experiences and how that has shaped your specific experience as a resident, and kind of learn from that.
I can go first. I think so. I went to UT Southwestern for med school, and so I was mostly speaking Spanish like every day to all my patients. And then I moved to Portland, Oregon, and it's still pretty diverse. Like I had 1 week where I spoke Spanish and had to use an Amharic, Ukrainian, and Russian and Turkish interpreter in the same week. Um, but I feel like just kind of having the background of my parents are immigrants, like I understand like people are coming in and they just like have zero idea what is wrong with their health or what's going on. Their health literacy is low for whatever reason. Um, I feel like that has helped me so much in kind of understanding the when people are saying, I'm worried about this, it's like not just like a silly thing. It's like, here's why they're worried about it. And it helps me understand the context of it a little more and connect with them better, which I think is very valuable. And as I'm sure you all know, and will just help you be a better advocate for your patients and can help you point out things that people may not think about. Like I'm very, like, I like, saying like, oh, maybe we should get the chaplain involved for these people. Like that might seem like they're spiritual or not, even if they're not, just to talk, or maybe we should get social work involved. Like it sounds like this person is having like maybe some worries about finances or transport to and from the hospital. So I think it just has helped me look at the patients, not as patients, but like as people that like have real concerns and are coming to us because they need our help. So
Yeah, kind of similar. I came from UCLA and Harvard UCLA where I did most of my rotations, and most of the population there's like 90%, 80% speak Spanish. So I spoke Spanish every day. And then the Upper East Side is just very, very different in New York. Like I think occasionally, like maybe, small percentage, like 10% of patients to five come in speaking Spanish. But one of the big ones that we have is our trauma rotation, like the Q3 is at Jamaica Hospital, which is in Queens. And there it's like similar to LA, where like 80% of the people come in and speak Spanish. And in many ways, it was very helpful for my team. I think our program is not the most diverse program. You don't have to like, you can just look at the resident profile and you'll see that. And a lot of times, I was leading rounds, as well as like seeing consults with my PGY3 because it was easier to have me speak Spanish and talk to the patient than to get an interpreter, which helped me a lot grow as a resident because I was seeing consults with him and just like leading rounds. So it had its own benefits as well, and then it was just easier for me to connect to patients. So it has its drawbacks and it has also its rewards. You're being a lot of times you'll be used as an interpreter, which is not something that should be done. Attendings definitely did that all the time as well. But you're also like, there's the big thing is that some of the patients, especially the Spanish speaking patients that I take care of, they just connect more with me than they do with my other co-residents. And so it just makes their experience and better. And so I've really gone to appreciate that, and I really like going to that rotation for that reason. It's just very different from the Upper East Side.
Yeah, I mean, I had a similar experience, but kind of in reverse. I went to medical school at Georgetown, where I think I was one of three or four Hispanic or Latinx students, and being in the hospital as a student doctor in a very homogenous sort of environment was at times difficult. And like Dr. Valenzuela said, sometimes they would just kind of use me as the interpreter for the team, which was fine because again, I got to connect with that specific patient population. Now in South Florida, things are awesome, right? Everyone speaks Spanish, or not everyone, but a lot of people do. And it's actually very beneficial to be able to walk into a room and, and just use my language and my culture, in a way that other patients can relate to, where they otherwise wouldn't. So it's fun.
Yeah. Thanks so much for sharing y'all's experiences. And I'll say, during the interview trail, I had the opportunity of visiting Dr. Avila. And she took me over to her parents' home, and I have never had coffee like that, I'll tell you. It was amazing, and I'll never forget. And it really, honestly, what it really makes me think is the value of community. And just, it was what, a 10-minute visit, but it was just so valuable to me, and how important it is to have our community. And just, I don't know, there's just something about it. And one of the questions from the chat, and kind of segues into this, is how did you guys handle time for therapy, for mental health, for making time for your families, your friends, during your intern year, specifically during residency? Is there anything that any pearls you guys can give us for that?
Yeah, I can go first. I think flexibility is key, is understanding that during intern year, I mean, yeah, as a whole, intern year is difficult, but there are going to be some rotations that are more difficult than others. And I think, if you have parents, family, significant others, dogs, cats, whatever, not that you're going to explain to your dog that you're going to be a little bit more busy this month, but setting those, or you might, but setting those expectations with your significant others in your life is important, to kind of set the stage for like, hey, I'm going to have a very difficult month this month because of XYZ. So I may need to be a little bit more selfish. I may not have as much time to hang out, but these are my days off. I mean, the one thing that you do know is when you're off and when you're on, so you can utilize that to plan ahead, and make those relationships more in a way more meaningful when you're actually planning out your time and letting the people that you love know that you are there for them. You're just not there all the time right now. And I think that's what helped me a lot during intern year, was to set those expectations way ahead of time. So that the people around me, even though they didn't understood 100% what I was going through, they understood that my time was limited and that I was trying my best. And then the other thing that helped a lot during intern year was to carve out some time for exercise. That has been, I think, the most important referral during my residency and my training. Is that, my intern year, I didn't have as much time as I have now, but throughout the 5 years, I just exercised as much as possible. And that was kind of my therapy.
Yeah, and a lot of programs will have like my program, and I know my med school as well, like had a specific resident or like medical student wellness program, where it's confidential and they keep that information like out of like the EMR of whatever institution you work at. So I would definitely inquire about that at your program. But I think also, like Dr. Avila said, like there's rotations that are easier and harder. And I think one benefit if your program has one of those resident kind of wellness things where they can provide like a psychiatrist, psychologist, therapy, things like that, is that they often have later hours or more flexible hours because they understand the grind. And I think just being honest with like yourself, and like thankfully I'm in a program where, usually if things like we can say like in advance to like our junior seniors, oh, hey, I have like a doctor's appointment for at this time. Can I just like step out for this hour? And you just kind of learn, okay, this, I'm not going to schedule in the morning when it's like rounding time or sign out. And I'm not going to schedule it on a day where I know there's a bunch of cases scheduled in the OR, but I can schedule on a day where maybe we're in clinic, or I know the census seems like a little lighter. So just kind of use your best judgment and talk to your like senior residents for sure about things like that.
Yeah, I'm just gonna kind of add on to that. We have a similar situation where like if you have a doctor's appointment or something to go to, as long as you let your seniors and know, it's never really been a problem. As long as you know do it in advance and have some common sense about kind of when that you can do that. The other thing that someone told me at the beginning of intern year was like, doesn't matter how tired you are, like make time for something so that you feel like a human being. And kind of like Dr. Avila was saying, for me, it was running, and so one of my like co-interns and I became good running buddies. And it was like 8 p.m. when we're done, and we just came off of like a long shift, and we still went for a run. Those are things that we do just because if not, I won't like we won't feel like a human being. But like the first 6, 7 months, it is really hard. Like again, like I think mentally it was just like very taxing adjusting. But then after that, like since then, I think we've been hanging out more, doing things, outside the hospital, even though it's like 7, 8 p.m. and you have like 1 hour and then you have to go to sleep. But like just make time to do the things that you enjoy because you don't want to lose yourself in kind of intern year.
Oh, those are all great points. Just to kind of keep track of taking care of ourselves as it helps us, I imagine, take care of patients. Another question from the chat was one of our attendees has found out that they're going to be starting in the ICU and they're freaking out a little bit. So do you have any advice for rotations like that are a little less operative and more so intensive?
May or may not be me.
Your nurses in the ICU are your best friends. They know more than you. And they've been there for longer than you. If you happen to have APPs with you, they also know more than you. And so it's important to, be humble and talk to people, ask questions. Asking your patient's nurse what her or his name is goes a long way. They will remember that interaction and like you forever, and they will be more willing to give you pertinent information about the patient if you just act like a person, and you're relatable and you're just nice to people. Just be nice to people. And by being nice, you'll go a very long way. That would be my number one advice.
Yeah, I think it's actually probably great that you're starting in the ICU because you're probably not going to like be expected to manage as many patients as you would on like a floor service. You have a bunch of backup, like Dr. Avila said, from like your APPs. There's probably going to be junior and senior residents, fellows, maybe like the nurses there. You'll have time to like, if you have no idea what's going on, you'll probably have time to like look it up on ICU rounds. And it's very it's like systematic, like systems based, the way you present ICU patients. So just one general recommendation for anyone is like figure out like how you're going to do your notes and see your patients and like stick to that this whole year. Like I would always I got super efficient at just like charting because I would spend my first day on a service or with a patient just like really making sure I like knew who they were, going through their chart and like setting myself up for a good note that was like succinct, but told me what I needed. And if anyone else picked up the patient after me, would tell them what was going on, what was needed. And then it just makes like the future like notes and kind of like information about that patient and the EMR more palatable and easier for you to know. So find a system and stick to it. And I think the ICU is probably going to be a really good place to start practicing that, in my opinion.
Yeah, I would have to also agree with the ICU nurses and the ABPs just being so good. I think for us, the ICU rotation tends to be the intern's favorite, mostly because your role is like again, you have fellows, you have a chief resident, so you're mostly learning, and it's not so much like you're the primary person here at Cornell. And so it's more of a learning experience. And so you can go and help with A lines or any kind of line, chest tubes. Like this is where you kind of learn. You can learn how to do procedures with your seniors and what they have them walk you through it. Versus sometimes some of the attendings can be a little intimidating, but the residents teaching you is always a good way to learn. So yeah, I think the ICU is a good rotation to start on.
No, that's wonderful. And so I think that was the last question that we had from the audience. So I just wanted to thank you all for your time. Dr. Loza-Avalos and Dr. Valenzuela already stepping into that teaching role and teaching all the interns that are logged on right now. Dr. Avila still teaching everyone even after graduation. Congratulations again. So for the audience, this recording will be available on Latino Surgical Society's YouTube channel shortly. You can also follow the organization on the social media on X, formerly known as Twitter, at Latino Surgery. Also on Instagram, where we'll be announcing other webinars or any other information of events that we have. You can also go to our website, to LatinoSurgicalSociety.com, that will have ways to subscribe or become a member, and also subscribe to our listserv so you can hear about future events. Again, thank you all for joining us, and thank you for taking the time. Hopefully this helps you feel more like a human. Buenas noches.
Buenas noches, everyone. Thanks for being here.